Obsessive Compulsive Disorder is an anxiety disorder prior to the DSM-5 because people experience anxiety as a result of their obsessional thoughts and their inability to carry out their compulsive behaviors. Obsessions are thoughts, images, ideas, or urges that are persistent, that uncontrollably intrude on consciousness, and that usually cause significant anxiety or stress, like order and exactness, doubting, religious, contamination, aggressive, sexual, and violence. While compulsions are repetitive behaviors or mental acts that an individual feels he or she must perform, like cleaning, washing, checking, ordering, arranging, hoarding, and mental rituals. Compulsion is what the person does to get relief from the anxiety the obsession creates. Depression is also sometimes thought to cause OCD, although again, opinion is split, with the majority of experts believing that depression is often a symptom of OCD rather than a cause. Also, abnormalities or an imbalance in the neurotransmitter or brain chemical, serotonin, could also be to blame. Major stresses or traumatic life events may precipitate the onset of OCD. However, these are not thought to cause the OCD, but rather trigger it in someone already predisposed to the disorder. Risk factors of having OCD are temperamental, which is higher negative emotionality and behavioral inhibition in childhood. Environmental, like physical and sexual abuse in childhood and other stressful or traumatic events, have been associated with an increased risk for developing OCD, and genetic and physiological among first-degree relatives of adults with OCD is approximately 2 times that among first-degree relatives of those without the disorder. As many as 66% of people with OCD are also significantly depressed. Panic attacks, phobias, and substance abuse are common among OCD sufferers. Between 1 and 3% of people will develop OCD at some time in their lives. Different disorders under OCD are trichotillomania, which is an impulse disorder that is characterized by compulsive urge to pull out one's hair. Excoriation or skin picking disorder, a recurrently pick at scabs or places on their skin, creating significant lesions that often become infected and cause scars. Body dysmorphic disorder, an excessively preoccupied with a part of their body that they believe is defective but that others see as normal or slightly unusual. How will you distinguish OCD? Symptoms for obsessive thoughts are fear of being contaminated by germs or dirt or contaminating others, fear of causing harm to yourself or others, intrusive sexually explicit or violent thoughts and images, excessive focus on religious or moral ideas, fear of losing or not having things you might need, while in compulsive behaviors includes excessive double-checking of things. Such as locks, appliances, and switches, repeatedly checking in on loved ones to make sure they're safe, counting, tapping, repeating certain words, or doing other senseless things to reduce anxiety. The most effective treatment for obsessive compulsive disorder is often cognitive behavioral therapy. Cognitive behavioral therapy for OCD have 2 components. First is the exposure and response prevention, involves repeated exposure to the source of your obsession. And cognitive therapy focuses on the catastrophic thoughts and exaggerated sense of responsibility you feel. A big part of cognitive therapy for OCD is teaching you healthy and effective ways of responding to obsessive thoughts without resorting to compulsive behavior. Family therapy and group therapy can also help people with OCD. It provides support and encouragement and decreases feelings of isolation.